waiting we do it. Now waiting we do oh. Pan the television, me say them talk about we. Pan the radio, me say them talk about we. Pan the newspaper, self them write about we. They no write nothing better, so bad thing about we. Now waiting we do. Now waiting we do it. Reverend don't pray tete, situation not change. Alpha don't pray tete, situation not change. Oh, then do we? Mercy. Now waiting we do it. Now waiting we do it. Pan the radio, me say them talk about we. Pan the television, me say them talk about we. Even the newspaper self them write about we. They no write nothing better, so bad thing about we.
This one we do in Creole, because this one is specifically for with Sierra Leone community within the England, UK, and diaspora. Other parts of the world are doing probably similar or the same or better, but this time for we own people then na England, yeah, UK here. Okay. Good afternoon, everybody. Good afternoon. Just to keep you updated, we can't talk about this COVID-19. We know they talk about the actual virus itself, but they can't talk about how we look after we as a community. For those of you who don't know me, Isatta Sisay-Jalloh of the Health Show. usually watched on live on Diaspora Voices. So my brothers and sisters, mama, papa, them purposely they do this live this afternoon because I just want to appeal to each and every one of us. It's very, very important we pay attention to waiting they go on now we country as a whole and all over the world as a whole, because sometimes we can be a bit complacent. Sometimes we can be a bit arrogant or even ignorant. And sometimes we can be a bit blasé. We always believe, say, something not happen to we, not to the next person it happen. And that not to just we in terms of this race, the black race, it can happen to white people themselves as well. All man, this world, all man feel say the next bad thing they happen to the other person, not to them. So today we can't talk about just COVID-19 a little bit, just coronavirus. Me not to a specialist, however, I've studied a bit of tropical medicine and infectious diseases. And more so, it's just my role in the community, the role I choose to become in the community. Which I feel saying that me own part where I go play now this we wonderful and amazing community within we Sierra Leone brothers and sisters, especially in the United Kingdom now. Yeah. So just to give an update, from yesterday, the 16th of March, this virus here, we all know, coronavirus, is a virus at the moment where not get any treatment or cure. It comes from the same family as the SARS virus. And there's still a battle how we then go sort them out, how we go contain them, and how we go keep her under control. We all know, say, come on, that we country, so they go buy but cool things. And these days, when are one of the top business country, then are the world now, the leading business country, China. And it don't trickle down, don't kill a lot of people, and they don't infect a lot of people. But at the same time, a lot of people will not die where they get treated with the symptoms. Until it don't trickling way through, it don't go America, it don't come the whole of most of Europe. It don't come between this England here as well. So waiting me and you go do about it, considering as the day goes by, every day with the yearly changes, with the yearly updates from the government and all the infectious disease team and Public Health England and NHS England and so on and so forth. What you go do about it? So just for you now, just a little bit of statistics. This COVID here, it actually, from the 16th of March, it actually now 44,105 people them have tested positive for it. Okay? And then out of them 44,105 we tested, we then test, they don't 42,562 the test then come back negative. So that's not too bad. So far 1,543 people them now they don't test positive. And out of that 1,543 people that we don't test positive, only not only, I don't want to say only because every life matters, but sadly 55 of that 1,543 people then they die of this illness. But one of the key things where they talk about, with almost 99% of all that 55 they we don't die, they're all age 80 and above, and a lot of them get underlying illness. Underlying illness, by that they mean either you get asthma, serious asthma, either you get other respiratory problem them, breathing problems them, or you get diabetes, or you get heart problem, or you get kidney problem, or you get cancer, especially lung cancer, or they take medication where they suppress your immune system. For example, some sickness and such as like lupus, SLE, and even HIV, you get some treatment the way they make they suppress your immune system, because your immune system they overwork for some of their illness there that make that they try for suppressor. So which is okay for you when they keep you going, but at times like this it puts you more at risk. So you got to be mindful of that and think about that carefully. So now then people then they at risk. The risk group now then people then they, and also the vulnerable young picking them way unwell. Not only well picking them, the one that way young way gets themselves get underlying illnesses, like people that way they suffer from cystic fibrosis, then chronic lung diseases, and so on and so forth. Themselves also they at risk. So that is what we're going to focus on today. So some of the symptoms, them the most common symptom what you look out for. Now that new persistent cough. Not to you will get smokers cough, not to you will get cough because you get respiratory problems already. Not to you will be get chest infection 2 weeks ago. This now that new cough where you they notice. Then it persistent. Then you they feel hot and fluffy and clammy, or you might not feel hot at all. So it better, I go advise everybody, if you haven't already, try for get a thermometer na you host, where they take your temperature, or you and your family on a temperature. Because a very important way you they call for advice to any of the helplines. Now some of them question and they then go ask you. So think about that, and that's very important. So those are the two most common symptoms. And the incubation time, which is basically from the time where you don't get the virus to the time where they begin manifest some of them symptoms there, can take up to 5 days. So that is why they're going on about what you should be doing, what you shouldn't be doing, cleaning, social distances, so on and so forth. So please, let's think about that and move on and go on and so forth. Okay, so in the United Kingdom, we've got a bit of advice again this morning. Then they say now, if you're on your own and you notice that symptoms there, you for self-isolate for 7 days. If you're not on your own, as in you get man, you get pikin, you lodge na house, una all rent one room na house, and so as long as not you one grain they live, well, one of una gets them symptoms there, una all for be isolated, una for action self-isolation straight away, and then una dey na house for 14 days, which is very, very important, because for try and see how best we can reduce the peak of this virus infecting new people, which is really what the government they try for do. That they hope say with all these restrictions in place, hopefully this go prevent the rapid doubling of this infection, because now from one day to another about 200 or more people that they get infected. So that they try for reduce that peak day, but also their isolation they are go help, especially the vulnerable group them, such as the elderly, we already get underlying illness. Them, the reason why make it go help them, it not go just only help them, it go help the mortality rate as well. Mortality rate basically means the death rate, because that the more they're at risk. So that is why they're talking about all these self-isolation. In terms of the schools, I will just mention a bit of the school, because I know a lot of parents, us parents are quite worried. They say, especially in this UK, why they not they lock school, why this country don't lock school, we know they lock school, and so on and so forth. Now, one of the things that where this country gets, where a lot of countries not get, I stand to be corrected, is we get a healthcare system when I'm the largest employer. Now, this is my own ideology. I don't know if not that way that the government they think, but now me own I am thinking thoughts this. And they think say, well, Probably the reason why they are so reluctant to shut down the schools, like from last week or the week before, where everybody they say lock. Now, because the NHS gets the largest employer now this country. So when you think of the logistics of that, Lord put the frontline workers first aside. Lord put the nurses aside. Lord put the healthcare assistants aside. Lord put the doctors aside. Lord put the anesthetists aside. Lord put the pharmacists aside. What about the cleaners? What about the people that where they cook now the kitchen them? What about the administrative people them? Where you go na hospital, you go na outpatient, you go to your GP, or so on and so forth. You must go first, you go register your details before them pass on. Yes, we get them machine the way they work, but we all know say once in a while, or most of the time that they go wrong, we need the manpower. So what about all those people? What would happen to them? Because when they lock school, we all then come around there, go for Sidona also. Me self now get 2 picking them. Okay, one old enough for them us, because we know say now this country, now UK, the legal age where you allow for left picking us to some extent, but for not more than 5 hours, is age 13. Now age 13. So imagine how many people them go get for left them picking and us unattended. No, you are not allowed to do that. I know say we can bend the rules sometimes, but legally we are not allowed to do that. So when you close the schools, what did they happen? All them come round and they get for Sidona us. They all get for Sidona us. So either they go mend the sick people then at the hospital. Either they drive the ambulance. Either they sit down at the call center for answer you call, where you call 999 or 111. Either they deliver the clinical materials. Either they get rid of the clinical waste. Either they cook for people then at the hospital, and so on and so forth. Either they issue the drugs them and medications. Look, because Lord not go self first yet to the nurse them and the doctor them first. Lord go to all the other people the way they make things work. Because when you look at the NHS, you get for think like a puzzle, where you get a puzzle where if one piece missing per that puzzle day, you're not able to complete the puzzle. That is how the NHS work. So now that make me, now me on ideology than you, now that make me feel say, now that make them they slow down things. Because also back, when you keep them picking the na us, how long you go keep them na us before they begin get bored for say, Mom, can I go hang out with my friend? So it really defeat the purpose. It's counterproductive because we don't see where other country they don't do. It no work. One country they are not go call the name. They lock the school today where they get fine weather. The next day the picking they all go sit on a beach. Now the same picking and come out school, then go sit on a beach. So we get to think about these things carefully and think with a level-mindedness. We get to think and think constructively before we begin worry, before they begin do scaremongering, just like what people then they do, whether they don't go na the supermarket and don't go almost chatter all thing na the supermarket. Now, one thing where people they don't realize, when you don't go chatter all that food then at the supermarket, we know say all thing gets a sell by and use by date. What if next week Corona done? What do you do with all that food then you host if so then get for expire in the next 2 months? What do you go do? So it's about thinking nationally, rationally and doing things step by step. The schools that don't begin close small. In fact, me picking in school from next week, year 9 they close. Now year 9 first they close. Why they don't choose year 9? Just like I tell you now, year 9 then most of them they now the age 13 to 14. So then can still able then host for about 5 hours or so unattended. So that is why they're doing things carefully and cautiously and strategically. You get for think about things, for just jump the bandwagon and begin do things and everything without any planning. It's difficult. So me begin in school the year 9, now that they go off next week. By this Friday, they don't set up the whole week coursework for them online. The one where in people they don't get online service, they can print all things for them on paper, because we got for members say this internet what they take for granted. Still, family then in this country we not get them. Still family then they when them picking and then at the household they not able to afford a laptop. We get picking them then at the house they not able to afford a phone where na Android phone or phone where they go na internet and so on and so forth. So we have to think how they accommodate all their picking and also some of them picking there. Wait till I get for realize poverty still there na this UK. Poverty there. And some of them picking there, the 1 grain guarantee hot meal where they get for the day. Now where they go school. So can you imagine where they stop for go school? That 1 grain hot meal self where they get for the day. You know, it no go there for them. And we all know, we always get picking them. We know how they eat now this country. Yeah? We know how picking they eat where they na us. The way where they shop and spend during holiday time, not also you they shop and spend during school time. So imagine where them go left them picking and they can house for we. That means you get for shop twice. If you be they spend, like me, I they spend about £30 a week on perishable items. That not all these bulk thing they want they buy you. These are things that like milk, yogurt, butter, sausages, and so on and so forth. Then things the way you know they able to keep for long. It cost me about £30 a week. So if they begin their can then house, I get for double that to £60 a week. You understand? Because then house all day 24/7, 7 days a week. Because for me, if they don't say they're not supposed to go school, then that means they're not going to go to a youth club. They're not going to go hang out with them, party them. They're not going to go do anything. You know, yes, Auntie Harriet, myself, they're picking in school, they ask for let we identify myself all the healthcare workers, everybody who they work within healthcare. Then they ask we for identify myself via email. So we get for be realistic. We really truly get for be realistic, my brothers and sisters. Let's think about this. Let we just educate who picking them for clean and be more careful. Let we self for be more careful. Because we community, like I say, we very, very dismissive. We very blasé. We know they take anything serious at times. So we get for begin things strongly about how they do things and what we they do. Now, the reason why I bring this up today is because we get for think the government not begin say hint, the elderly 70 and above, where now they are the most vulnerable, especially in terms of the death rate where they get this disease. Then they consider for quarantine them for 12 weeks. You know, then they consider for quarantine them for 12 weeks. So we as a community, what we go do for we elderly people, where then are this we community? Whether you did North London, East London, South London, Central London, West London, as a Sierra Leonean living in the UKI, including Scotland, Wales, waiting with a think for we elderly people where they live on their own, where they use every 2-3 days, where they give them the weekly benefit. Now then they go shop na East Street or Peckham or Dalston or wherever they live. What are we thinking about them? So now that's I don't make this live today, my brothers and sisters, because I think say as a community, I want for encourage we put together a response team for the elderly there. A response team will go provide support in various ways through multiple media outlets that we community able access. Through other ways such as providing food for them people there. So me, I dey plead on anybody, healthcare professionals, community activists, with local celebrities, religious personalities, young activists, the active Sierra Leonean communities across the United Kingdom, as in then other towns like Brighton, Birmingham, Manchester, Coventry, Reading, Leeds, Scotland, and Wales. Una check. You know, I don't need for Biboku. I don't need too many people. I need just about 12 people. And them 12 people that they want need. Now people that way get a full driving license, we're able to drive. The reason why, because if we need for provide food for them people there, We go create a shift pattern where we go able, some people when not they work morning time, go drive, go deliver them food there. Some people where they go work evening time, go drive, go deliver them food there. And that could be, you know, non-perishable provisions or just even a hot meal for we mama and papa them, and we granny them and grandpa them, and we auntie and uncle them. We might be living on their own. We no get no family. Where then dependent on that then weekly pension whether they get or whatever little benefit for let them draw that and trolley, then go shopping. They might be okay the first 1 week. They might be okay the second week. But what happens when they start running out of milk? What happens when they start running out of rice? What happens when they start running out of so on and so forth? What would happen to them? So now them people then they I want we create a response team for, so we go support them people and they do ya, me brothers and sisters. So if you're interested, you can inbox me. You can inbox T-Boy, Seria Gem Media. You can inbox DJ Little on Diaspora Voices. You have our numbers. A lot of you have our numbers. Call us if you know of anybody where fit that bracket there. So we are looking for the elderly, 65 and above, where they live on their own. We also look for the elderly, where 65 and above, they might not be living on their own. They might be unwell. They might have somebody with them as a carer who is a bit restricted. You know, go able for they come up for go buy things them. Because he's afraid for go make it go expose himself, you know, make it not come pass and give in person. So please, let us set up this rapid response unit for we Sierra Leone community. I live in Sodok, so we're gonna base it in Sodok. Why? Because Sodok has the largest population of Sierra Leoneans in the United Kingdom and Ireland. So that is why we're gonna base it there. So I want 12 people who have a full driving license to join me for this delivery. So all you other people, what I'm expecting of you is for check you with your friend or your family, for make sure say if you know of anybody, any of the elderly will fit one of these criteria. I'll repeat it: 65 and above, living on their own, or 65 and above, living on their own as couples, but they're also, you know, 65 and above, living with a carer, where because that 65 and above not well. And then the other group of people, what they look at is people with children who are vulnerable. When I mean vulnerable children, people picking them where get some sort of illness, long-term illness or chronic illness or disabilities, where then them parents, now their main carer, they might also get stuck. Because we know say, if you're a single parent and you have these children, then you maybe carers then go stop for camp, because a lot of people go get carers where go can help them so that then go get a bit of respite. But the way things are going, some people will stop working. So everything is going to be minimal. So please, 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 I'm begging you, I'm asking you. I have a garage, so storage is not a problem. DJ Little has a garage, so storage is not a problem. We're not asking for much. Even if now 1 baked beans, you know, it go be fine. I'm going to speak to different people now, community, where get stations or areas where people they go, where they can go drop something they if they can, you know. So please, and because a man go say, if we can't give this girl all this thing here, then Corona do wait to go do time. I think say by now, una know and appreciate and respect me integrity. I go take all them things in there. If not in the way they expire very quickly, like in the next 3 months, I will go donate them back na food bank na this country. If not things then when they expire for a while, let's say about 12 months, I they put them na box, I ship them, I go give people them na salon we need them. So it's going to be a win-win situation. And my sister Auntie Harriet, oh sorry Auntie Harriet, I forget you self get garage. My sister Auntie Harriet self get garage. So do ya, me brothers and sisters, let us think about this carefully. Let us try and be selfless. Let us think sensibly with a level head. Whenever something can at the media, try for practice the 3 P's. You pause, you plan, and then you proceed. You know, you pause, you plan, you proceed. No see something no more on news, you begin holla. Oh, now so they don't say now. Let them lock here. Why they not they lock here? Why they not they lock here? The one when they not lock it. Today I go na market, East Street Market. Indomie, what would they buy for picking them? 5 pounds. 3 weeks ago. I buy a 8 pound. I buy Indomie box 8 pound. You know how much today for Indomie? 20 pound. So side they even sell at 22 pound. Indomie alone. Rest. That rest where they buy 15.99. Today, they sell on 27 pound. I go waka because I just the waka for see waiting they go on now the area and the shop them. All the shop them, we get this old country road here near we get big Tesco, we get big Asda, we get big Lidl, we get big wholesale Iceland at the bottom Dondon, we get Aldi, they all today I no work, I take me time, I don't go work now. All them shop they're all done empty. So we got to begin think about how we they improvise. Because what if this thing goes longer? And like I said to her, the longer the picking and then a us, the more they eat. So if you be they spend 10 pounds for the week, things say no more, you get for double and to 20 pounds with them picking and then a us. And we all know how they picking and they eat in this country. And not tell like back home, if breakfast day, then give. Wait, then cook, una eat. If you get luck, you go get tea soup. With them madingo there. We call it tea soup, evening food. If you not get luck, if you get orange behind the house, you go pick a eater. If not, you drink boku water, you go lay down sleep. But this country, we pick it that they eat half. Me baba na 6 egg they eat for breakfast. That 1 liter milk where you buy them, na 3 times they eat cereal, you don't done. So literally almost every other day, I get for do replenishing. I make I say me own household with just 2 children, myself and a husband and 2 children, we they spend 30 pounds a week on perishable items. So if me picking and then where then they go school. If then us, I am expected to double that up because they're going to eat more. So my brothers and sisters, let us think about that. Let we think about we own role within this infectious disease where they go on. Let we think about it. How we go help as a community. The government already begin tell we today about social distancing. Let us start practicing social distances. We community, a lot of people have done well already. They'd already canceled events as far as April. Let us encourage people to cancel events. It is not the end of the world because Uda in right mind actually they go any event this hour where they say minimize 10 and less in terms of groups. Uda in right mind. So please think about it. This weekend we passed, it was amazing, it was interesting. There was lots of events. People then put on our social media, they see people that they hug, that they kiss, that they rub by themselves. We are yet to be lucky if we community not get a yet. We are yet to be lucky. That's not 100% whether we community somebody not contain a yet. But we have to be mindful. We get for be vigilant. We get for practice. We get for practice the simple things. Like if you cough, you sneeze. Try for cough and sneeze now a tissue or you close like this, or that's, or, And when you done, go wash your hand as soon as possible. If you don't get soap and water with soap and hot water. If you don't get them, then use hand sanitizer. But the primary practice is soap and water. Make sure so you rub the soap on your hand, you rub your hand, you rub your hand like this, you rub your hand, you do rub your hand for good 20 seconds. Good 20 seconds, you do rub your hand. So the whole process, you know, by the time you done, it takes you about 40 to 60 seconds, sorry, for do that hand washing day. But make sure, say why? Because this virus in your skin layer, not that strong. And soap they break down fairly quickly. So if we do that, it will help. Then if you know say you dey cough, you dey sneeze, no go outside you company and day. Please, no go there. It is not fair on others. You know, think about yourself, but also always put other people first. Okay? And then by the way what they try for reduce the spread of this germs here is regular cleaning. Do regular cleaning. I be they listen to a virologist, somebody who study virus basically. When I work number for study how virus then they behave, how they survive, waiting they make them tick, waiting on they make them tick. I be they listen to him. He say this particular coronavirus, there's an average survival rate outside we the host now about 9 days. And even that if you dare on a cardboard surface. If you dare on a wooden surface, like you dining table, you sideboard, or you TV unit, if na wood, they survive for about 5 days. On a glass surface, it survive for about 3 days. So please, regular cleaning is very important, especially areas them where they touch and use a lot. Now we house them. Wash your hands. Do things, you know. I know say some people go say, me ambulance wash me, I'm waiting at the say. No, do it more often now. Where you cannot also you wash your hand. If you sneeze, you cough, wash your hand. So please, 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 my brothers and sisters, let us think about all these things. And before I start this live, there was news came out saying soon that they think of canceling all the non-urgent operation them. And the reason behind this, they want free up to 30,000 beds. So if this thing reach in peak, which they hope it not go reach, but if this thing reach in peak, whether they consider say that they go be in the next couple of weeks, then get them bed the day. So please, let us do our own part. This is not just about me. It's about all of us in our community. Let us create a focus group, a rapid response group for we elderly and the vulnerable. We might be able to survive 1 week or so, but after that, they might not be able to survive because they would have run out of food. Let us also think about our own traditional food. Wait till we get what we already go utilize. For example, we like dry rice, what we call lafidi madingo. Think about that. Go buy your rice, buy pepper, buy jakato, boil them, freeze them, buy you okra, buy you cow butter or you butter. We all know say we can live on dry rice and pamine or dry rice and butter and lafidi for quite a while. A lot of us get kenda, beni, na os with Maggi. So let's see how we dey able to stretch that. Now we buy gari. We dey eat gari and sardine a lot na salon. Now we buy gari. We can able to eat that day. Buy minced meat if you get space for freezer. So for them picking there, you dey able make minced gravy. If self you run out of pasta and spaghetti, you can able put down a pan rest for them, then go eat them. You go able put them pan bread for them, then go eat them. So let's think about all those things. Let's think about what we already get now with us, what we go able use. Rather than begin for the go, the panic buy and so on and so forth. Encourage the pikin them for use water. Encourage the pikin them not for be wasteful with them food. Because I know say we pikin them sometimes that they go cut more food than they're able for finish. Now we encourage them for eat what they're able. If they're not full, then go cut more. So please, my brothers and sisters, I'm not gonna keep you too long. Thank you. I'm just gonna go through the comments. Again, we get with lot of Salon brothers and sisters. We get shop them, we get things them, where we go contact them, then go help, then self ready for gift stuff, and so on and so forth. So Harriet says, I have started in my area. Not to Boku Talk na Facebook. Please, let us come up with the plan. My ward cancelled all elective surgery. This is a serious issue. Of course, Auntie Harriet, this is not serious issue. You are number one on my list. You are number one. I've got Nima. Now I've got Golfer. I've got Sisay-Jalloh. I think I've got people. We might not need to do it at all. But let's just put a team together that if we need it, what is the embassy doing, if I can ask? Me, I don't know about the embassy. Me, I don't know nothing about the embassy. I'm just doing my own as a citizen of Sierra Leone. And they do me own. Now this Milili community, yeah. So, if the embassy is doing anything, that's fine. I don't know. So, everybody's watching. Nima, yes, I know you're available, and I know your husband is also available, and so on. And yes, we can use the youths. That's what I said. The youth activists, healthcare professionals, we local celebrities, we religious personalities, and so on and so forth. Anybody that is willing to help and support. And also, if you think, I really not get time, but you get that one extra baked beans. You get that one extra sweet corn. You get that 2-3 Indomie where you go spare. You get that one packet pasta where you go spare. You get that one tin sardine where you go spare. You get that one toilet roll where you go spare. You get that one bottle cleaning solution where you go spare. It is all good. It is all good. So again, Harriet, you can even get a community hall if we can have more items. I know, but at the moment they're trying to say we should minimize social gatherings. But if it's to drop off the food, yes, But what I'm going to do by Thursday, they go all local. We get a lot of local sisters and brothers them we get shop. I already don't start today na East Street. I will continue on Thursday. I will go now all the different local stores that were owned by we Sierra Leonean brothers and sisters and go put the word before them. So if they say, okay, if they're able to give something where we need them, then fine. If they don't mind, let people then go drop things into them, that's fine as well. So every little counts, every little makes a difference. So I'm glad I'm making sense. And thank you, Aminata, yes. And thank you also, Fatmata and Darami. Yes, it is. We have to do something. Alima, you already know 3 people with it. That is it. This is what I'm saying. We have people we think we know. We don't know. We have people already. And are they taking the appropriate measures to protect the rest of the community? My brother T-Boy has put it there. If you're interested, please inbox or text myself, DJ Little, T-Boy, and so on and so forth. And call us. Our numbers are readily available. Please, please, please. I thank you so much. We'll continue keeping you all regularly updated. It is very important we think about this and think carefully and know how to support with community. Let us stop the unnecessary gatherings. Let us stop do what we have to do. Have a lovely, lovely evening. Look after yourself. And remember, hand washing is the key, and try and practice social distancing. God bless you, and I love you all. Thank you very much for listening to myself, Mrs. Isatta Sisay-Jalloh, from the Health Show Partnership Program. usually live on Diaspora Voices. Thank you and God bless you.